The traditional universities that are allopathic medical schools that churn out doctors, and the organizations of different specialties, I do not know of any that recommend it. And the reason for that is, first of all, they want everything proven and go into the textbooks before they will honor it. And I respect them for that. But you have to remember, there is a very heavy component of financial interest, politics, drug companies that sponsor medical schools, that sponsor research, that play a role. For them, this is a big competition using alternative therapies and this and that. And it takes a bite out of their income. So that doesn't surprise me, because I know that the standard, the touchstone by which everything is measured in our country is profit making. Everything starts from Wall Street. And these doctors and organizations, they are not over and above that. I can tell you how many drug reps and people who sell me gadgets to do procedures in the office or at the hospital, they are constantly going to doctors' offices and bringing in free lunches and bringing gifts. I don't allow them. I said only receptionists will talk. A doctor will never see them. So if a drug rep comes and is a buddy-buddy with the doctor or with the hospital administration, after a while, the person who is getting all these free gifts feels obligated to kind of sell their product. From prenatal vitamins to gadgets, there may be 10 companies that make this equipment to do certain kind of surgery that sells to the hospital. And if they can win over the hearts of the doctor, the surgeon, he's going to tell the hospital, that's what I like to use. Hospital will order what the doctor says, because they also want to make a profit. So this is a very lobby group based business where academics are not pure academics. Academics are contaminated by influence, by lobby groups, by money, by profit. Do you know how many doctors go out and lecture on behalf of companies and they get $20,000 for a lecture? That's not bad. They all of a sudden, if you lie 5 times or you lie over and over again, you begin to believe it. It becomes the truth. So some of these people who promote certain kind of products or drugs, in their heart of hearts, they know that they are equivalently good drugs or better drugs, but they got hired by a company. The only thing they have to do legally is to give a disclosure. When the slide goes on the screen, they say disclosure. Yes, I have a relationship with this company. There will be a little sentence in small letters. They don't have to tell you anything else. Bioidentical hormones, the studies are done by only those groups who have practiced it. If you're interested, I will be happy to print out lots of articles for you. There's been plenty of research, but it's been done by people who practice bioidentical hormones, or their groups or their organizations. There's international and national organizations that practice and promote bioidentical hormones. There's plenty of research. So it's available. The research is available. And they, of course, promote. And there is a tension between the two lobby groups. And that's part of the reality. Let me move on to the next topic. Actually, I don't have any track of time. I don't want to go over. What's the time, sir? Okay, so 11:20. Okay, so we can talk 10 minutes and then open the floor. Is that fair? First of all, I think we should give him a big hand. I have not seen many people at 77 looking like him. And I also want to tell you, I'll answer your question in a second. Insurance companies carry what is called actuary tables, actuarial tables. And if you look at those tables, and if you put next to the graph, look at 77, and you not being overweight, and if you do not have any chronic problem yet, like rheumatoid arthritis, blood pressure, diabetes, according to actuary tables, your lifespan is already close to 100. If you tell me, I'm assuming, unless you tell me you have blood pressure, you are on medication. If you are not, and you exercise daily, according to that table, I can tell you, go check that table, you might live close to 100 if you are exercising and do not have. And not many men live to be 100. Okay, money, the question with money is, you ask yourself always, what do you desire versus what do you need? If people can figure that out, what is it that you need versus what do you desire? You can still live happy and dramatically take that retirement money and use it for much longer and still be happy. Yes, you had a question, I'm sorry. You raise your hand.
In November, I will be 83.
Okay, you look good for 83.
I'm still taking Premarin.
How much are you taking? 0.62? 0.62?
0.065.
Okay. Do you still have your uterus, if I may ask a personal question? You have a uterus?
No.
You don't have a uterus?
No.
Did you have hysterectomy?
Yes.
That is rather a high dose of, how many years you've been taking that?
I'm not even sure.
Okay.
I had the
Too many years, that's your answer. You've been taking it for too long.
But probably 30 years.
Okay. Congratulations, because you're still alive. I cannot tell you how many patients come to my office, and 10 years after that study came out, Women's Health Initiative, they are still taking that high dose of Premarin along with high dose of progesterone, which used to be called Prempro. And I asked them, who is giving it to you? Someone must be redoing your prescription. Their primary care doctors, 10 years after that study comes out, still giving them. Some of them are taking them for 10, 20, 30, 40 years. And I tell them, you are very lucky that nothing happened to you. So you really should consider weaning off. Weaning off is another problem for patients who've been too long on a very high dose of Premarin. It has to be weaned off very slowly. It will give you heart palpitations and symptoms if you quickly stop taking. So you can't do that. You need to wean off over 4 to 6 months and try to start replacing with some other natural hormones so you don't get symptoms. Once you wean that off, then you're safe taking some natural products. But you've been on it for too long and you took a lot of risk. For example, I have a lot of patients who come to me for the first time see me. They have used the Premarin way back for 10, 15 years for long term, and then their doctor found out 10 years ago, don't use it. They stopped. And now they go get the DEXA scan done. Their bones are great still. They're 65 because they benefited from Premarin, but they did take the risk. They got lucky. They didn't have a stroke or heart attack. That's what the study shows. So I do not recommend you continuing, but also I don't recommend you suddenly stopping it. You have to do it very carefully and very slowly. You have taken it too long. You have a distinct risk of stroke or heart attack on that high dose.
That's why I'm here.
Okay, let's move on to the next. We can talk another 10 minutes and then we take any questions. Okay, what is new in this area? I want to tell you briefly that some patients they take hormones and they don't respond too well. And in that case, I'm finding out that sometimes don't assume that all your problems are hormones. Okay, you have the rest of your body. You have other things going on. You have muscle, heart, bones, lungs. You have a brain. So something can happen to any part of your body. So that needs to be investigated. What I have found the hard way is that very often the problem, the hormones of course benefiting in some way, but that do not expect it to solve all your problems, because sometimes there are other things going on which frequently happen with aging. Then what I do is on those patients who don't respond very well, we test their urine and we test for all the amino acids, all the neurotransmitters of their brain. And I'm frequently finding out that the patients who don't respond to hormones very well, in terms of symptoms, they are benefiting in terms of osteoporosis and Alzheimer's disease, but in terms of symptoms, they're still depressed and their anxiety is not going away. I find out very frequently that they have some neurotransmitters of the brain is not making. They have a deficiency of human growth hormone. They have a dramatic deficiency of serotonin or dopamine levels, or too high epinephrine, norepinephrine. And then we treat them accordingly, according to that deficiency. Now, some of the psychiatric drugs, the depressants, they also work to change those. The problem with using psychiatric drugs is that very frequently primary care doctors or even psychiatrists, you go to them, you say, I'm anxious, depressed, you tell them your problems. What do? They listen to you 5, 10, 15 minutes, and they write your prescription. They never ever bother to check what is it that you assume that the same pill is going to work. No wonder 1/3 of the people respond to antidepressants, the other 2/3 don't. Half the people respond to anxiety, or it fixes their problem for 6 months, then anxiety comes back with a vengeance. So I think we take a different approach. We test all the neurotransmitters of the brain and we replenish just what is missing, or do something to bring down what is being produced in excess. Again, fortunately enough, there's a company, Neuroscience, that's the only company in the United States who started doing this. Actually, traditional medicine, they won't even recognize that you can test neurotransmitters through the urine test. But we can show you actually they are expelled in the urine. There are about 15 of them. We test and then we replenish only that deficiency. And a lot of people respond to that. I'm finding out something else. That human growth hormone, which we did not think much of it before, now it turns out that may be a major player in the aging process. Especially people who have a head trauma, and I'm not talking about a trauma where someone took a baseball bat and or rip open your skull. I'm talking about those traumas which frequently get ignored. For example, you had a whiplash, and your head went back during the accident 5, 6 times. Brain is like a jello. It really is literally like a jello, hit back and forth inside of your skull. Or you had minor concussion. They take you to the emergency room, they do all their MRI, this and that. What are they looking for? A bleed in the brain? Or that's what they are, if the tissue got torn, that's what they're looking for. It doesn't show, they say, you're fine, drink a glass of water, go home, you're going to be